Loud. Okay, we're up. Thank you, everyone, for being so patient. And like I say, this is Marsha McGinnis, and I'm hosting tonight's meeting, which is our general meeting, where nearly each month, we bring in a special guest to talk on an area of expertise that the speaker knows all about. And this month, we're very pleased to have as our guest Rosa Warder. But before we begin, there are just a couple of things that I'd like to um, let people know about. First of all, we have our newly published newsletter that I'll put in the chat box at some point tonight. And we just finished it today. And we also have received from Alameda County Behavioral Health a particular brochure that I find extremely helpful, and it's called the Mental Health Emergency Guidelines for Calling 911. Now, if you don't live in Alameda County and you're listening in tonight, this only pertains to people who live in Alameda County. Um, so other than that, let's see, I am going to just introduce you to our guest tonight. Um, so Rosa Warder became a family member when one of her sons developed a thought disorder at age 12. And she went on to develop the Family Partnership Program in Alameda County Behavioral Health's Child and Adolescent Services in 1999, and then developed the Office of Family Empowerment in 2008. She continues to advocate for the family voice by working with providers, elected officials, and future clinicians. So tonight she'll be speaking on the importance of family members in mental health care, advocating for your loved ones. So Rosa, do you have a slide presentation that you need?
Absolutely not. No, I am
I
done.
love it.
Done
Thank
in
you.
by slides. No, none of us need another slide presentation. No.
Thank you and welcome. Good to see you.
Good to see you too. No, I thought I would basically tell you a little bit about the Office of Family Empowerment for people that aren't aware of it. And then I just really want to hear from people about what their needs are, where they feel that there are gaps. I know there's so many gaps, but just trying to get really an opportunity to hear from you and bring that back to leadership. That's really why I'm here.
Thank you.
So the Office of Family Empowerment, it's part of the Mental Health Services Act, Prop 63 funded. That is what's known as the millionaire's tax, that 1% of the second million that people might be able to make in California in terms of earnings. And that funds my office as well as the Office of Consumer Empowerment. And we're a very small office. We actually only have 3 people, myself and 2 other people on the team. And what we focus on, because of how smaller we are, is really collaborating and partnering with all kinds of community services, providers, legal aid services, housing services, food banks and other food insecurity issues, and of course, advocating for things locally, state, and federally as they come up through the legislative pipeline. Because we're such a small office, we don't actually do direct services, although we kind of end up doing them sometimes, because when you get a phone call from somebody who's really in pain and doesn't know what to do, you don't turn that phone call away. So we, sometimes people somehow end up with one of our phone numbers or email addresses around a personal one-on-one direct service kind of issue, terrified about a family member. And so we, of course, take those on and follow them through until we can either resolve it ourselves or do a warm handoff to either a treatment team or the Family Education Resource Center or the local NAMI, because often people just really need to know that they're not alone in dealing with the things that they're dealing with their loved ones. So we mainly do a lot of technical assistance and training of clinicians, legislators, and future clinicians to really help them understand the importance of family voice, the importance that family members make to our consumers / peers, because we are who they come home to. We are who visit them when we could visit, hopefully again soon, in psychiatric units, in mental health rehab facilities, in jails, etc. We're the people that have that unofficial title of family / case manager, and us also at the same time we could be the ones who are the most attacked by our loved ones, because they're generally adults at this point and they want the freedom and the separation that they would normally be having in their lives. So it's a very tricky balance. We're very aware of that. So we do a lot of work around skills to help family members cope with what they're dealing with, including coaching and motivational interviewing and various self-supporting, self-help kinds of activities, but also working a lot with clinicians about how they could better talk to us even through HIPAA, how they could better explain things through hypotheticals, through communication that is, will not violate somebody, but at the same time knowing that that person's coming home to us, setting us up for the most success. And we're working on programs to improve that even more around training of clinicians, as well as training of family members about how to talk with clinicians and not violate HIPAA, and at the same time get the information from one end to the other that's needed so that everybody has a better outcome. Our team, like I said, we're just the three of us. It's myself, Tanya McCullum, and Beth Sauerhoft. And we are actually just got yesterday in the mail email that we may be able to hire for a fourth person who will be focusing specifically on adult and older adult issues. So I'm very excited about that. And even though I know the county hiring process can be challenging, to even be in the queue is a big deal. So that's me. That's what we do. We do lots of community outreach, lots of trying to get people, family members who have not been at the table, at different tables. We want to go much, much further. Pre-COVID, we had actually a very strong community action plan to actually be going back out into senior centers and churches and community centers and farmers markets and all kinds of places to try and get more people involved that are not normally involved in NAMI or family representation at the county level. And of course, COVID has made that pretty much impossible, but we're still doing as much as we can possibly do with Zoom and with email and posters and flyers and anything we can do to get people to understand that there is some place that you can go for help. Nobody has the magic bullet, but there are other people that have, are living with the same issues that you are and have navigated even more places and systems, and we can help each other. So that's a big piece. And at that, I think I will actually open up to questions. They can be personal to me, to the office itself, things that you are interested in knowing more about, and see if I can answer them. And if I can't, I will be writing them down and I will get those answers for you, and I'll get them through Marcia and they will get to you.
So you can certainly put your questions in the chat as well, as
Right.
if you wish to do this live voice. So.
What are the top two most common calls I get? That just showed up in the chat. The top two common calls I get is one, that my loved one is in jail and I don't know how to get information to the jail about their history and their health needs and their medication, etc. That's a big one. Luckily, we have really good relationships with Santa Rita and with San Francisco. and starting to develop more relationship with Contra Costa as well, because people are moving out of Alameda County because they can't live here. And we have, formulas to help people, like, who to call, how to get that information forward. Also frequently using the 1424 form, which is that family form. You're probably familiar with it. It's a form that allows family members to give a history of what has worked, what it has not worked, for their loved ones, so that it accompanies them on 5150s and other types of calls, to get them crisis services. So that's a big one. The second most common call I get is, why do we not have enough hospital beds? Why are people being turned away after 72 hours, even 24 hours, and not being kept long enough to get stabilized in their medication? And unfortunately, the answer to that is our billing system, which is federally mandated Medicaid here in California, Medi-Cal. And what it ends up being based on is acuity of symptoms. So even if somebody has only been there for 2 or 3 days, and they've only just begun to get a blood level that's appropriate therapeutically on medication, if they're not currently acting out in a way that, quote unquote, would be making them dangerous to themselves or others, they're often discharged, and discharged with way too quickly without an appropriate discharge plan, not necessarily down to a mental health rehab facility such as Villa Fairmont, that kind of thing, and end up right back in the cycle. And that's one of my hardest calls, because at this point, there's not a lot we can do other than at state and federal level legislation around Medi-Cal billing. In our last administration, I felt pretty hopeless about that. In this administration, I have some hope that maybe we can make some changes at the federal level that will trickle to our state and local levels. We do not have similar in Contra Costa County. That showed up in the chat as well. Many counties with their Mental Health Services Act dollars chose to either only do a Office of Consumer Relations or do a combined Office of Consumer and Family Relations. And over the years, the family piece, unfortunately, usually gets kind of moved out. So we're very lucky that we're funded to have our own office, even if we are totally understaffed, underfunded compared to the consumer office. Do you help families find alternative living situations for no? So no, we do not help families find alternative living situations for their loved ones suffering from mental illness. What we will do is work with families to talk with the case managers, if they are case managers, and connect those case managers if they're unfamiliar with the various housing options that exist. But we do not do that particular, that's a very specific subset of services with its own very complicated funding, braided funding all across, from FSPs, full service partnership, to SORs, the single room residencies, to actually Section 8 and supplemented housing. So those are things that we really work with the housing office to help resolve. The housing office and Robert Ratner are no longer part of behavioral health care. That is now part of Healthcare Services Agency. So we're developing new relationships around housing and new contacts. I'm trying to read the chat here. Give me a second.
Carol, could you mute, please?
Oh, I thought I was.
Thank you,
Wow.
please.
I thought I was muted.
Okay, here's a question. The entire process and system of care and treatment for the mentally ill is extremely opaque and feels impossible for families/parents to understand. Do you have any material that sets out the system, facilities, processes that family have to go through? Yes, we do this through the FERC, the Family Education Resource Center. On their website, they have in multiple languages a deep dive of the system, going through regular services, ongoing supports, what to do in a crisis, resources, etc. And in the upper right-hand corner, it lets you move to any of our 5 threshold languages. And that's one of the things that we fund them to do, is to have a really good website that really helps explain how to navigate our system. Because if any of you have looked at our Alameda County Behavioral Health website, you know how bad it is and how impossible it is to navigate. So I move people over to the FERC website to really get an understanding. In terms of outreach, we do outreach through specific providers and specific community settings. So it sounds like you have only recently heard about our office. We did do a lot of publicity when we first started. We've lost a lot of funding over the last few years, and especially this year with COVID, in terms of actually setting up an outreach kind of thing where we do more flyers and more of those kinds of events. So because of that, we've actually combined with the Family Education Resource Center and with NAMIs, and I send out everything that I possibly comes across my desk to a large mailing list that then requested them to send them out to theirs. So we're basically doing a pass it along so that we can utilize our limited resources as best as we can. When we were pre-COVID, we would do some health fairs and some other in-person things to get people aware of what the options and resources are. But right now, obviously, it's all happening online. I'm looking at, okay. I care for my wife who struggles with a personality disorder and depression. She has decided disability insurance. She has declined disability insurance and she hasn't worked since 2010. Any advice on some other resource she could apply for? She really feels she's a burden to me and adds to her depression. Oh, that's so hard. I feel for you. I can only suggest that because she was a working person and contributed to the society, not only as a worker, but as a mom, that this is something she's paid into. She's paid for this. And to hopefully help her understand that this is something that she should accept because she has paid for it and she deserves it. There's not really much else to apply for. Social Security, SSI, SSDI are pretty much the only income streams that you can apply for when you have a mental health disability. And the only other piece is sometimes food stamps and Medi-Cal, depending on what your total household income is. But I think, it's really important, and I think this particularly happens with women, that women often feel like they don't deserve the extra. They could see it as extra funds or see it as something that maybe should go to somebody who's better off than they are. But we generally, as a country, we have a tendency to have been working either legally or under the table since about the age of 12. And we deserve to have whatever benefits that we've been paying into through our taxes. And I just hope that you can find ways, and maybe other family members can find ways to help her know that she really deserves these monies. She's already worked for them. She's paid into this system. And this is something to help her and take some of the stress off of her so that she can focus on her recovery and focus on, being as well as she possibly can.
Rosa, I have a question. I know that a mental health association, Alameda County, for years assisted people in with applying for disability and helping them if they apply again because they're due to being turned down, especially the first go around. And I know they lost that contract. Who's doing that now in Alameda County?
That's actually now it's actually up for bid right now. And I
Oh,
think it's both being done in-house with Alameda County, and a big chunk of it is, I think, been awarded to Alameda County Legal Aid. But let me double check on that because I don't want to give you the wrong
yeah,
information.
that would be really helpful. Thank you.
I've seen so many emails about this that I could easily give you the wrong information. So let me just make a note of that.
Thank you.
Are severely mentally ill persons covered by the ADA? Do you know why they're not given additional services like those with physical disabilities? Yes, people with mental health disabilities are covered by the ADA. And because mental health disabilities aren't something that people can necessarily see, there's a lot that people do not receive. And there's a lot that people do not get accommodated for because often symptoms of the disability are behavioral, and that tends to bring a whole different kind of energy into the scene. There are resources that are available, such as mental health service dogs, therapy dogs, different kinds of housing supplements, etc. But they are truly a tangled mess to get to, which is why it's so important to have an advocate and become your own best advocate for your family member to find out what they are possibly eligible for. For instance, we've been able to get clients / peers who are living in subsidized housing and FSPs to be able to have service dogs, which was maybe not allowed in the actual building or apartment. There maybe not have been animals allowed, but we've been able to work with the case managers to allow those animals to be part of the treatment plan for individuals, as well as working with crisis services, as well as our local Petco and Pet Food Express and our local shelters have been doing a tremendous job of offering food, low-cost vaccines, other ways to support people to have an animal companion. Other things that we, I feel would be really helpful would be things like Chromebooks and low-cost Wi-Fi, which can be applied for through Xfinity and some other community groups and organizations and companies, but it takes somebody to literally spend hours on the paperwork and the phone calls and really advocating to get those kinds of services for people. It's not as easy as, and not to say that being physically disabled is easy at all, it is not. But generally when somebody sees a physical disability, they're able to receive walkers and wheelchairs and transfer benches and a bunch of things that come under the heading of durable medical goods that aren't even thought about for folks with mental health disabilities.
Okay.
I'm not sure what this last question is. It says, what about therapists to work with patients? I'm not sure what you mean by that question. Could you elaborate on that? Seems like it came from Brian and Paula. No? Yes, maybe you're muted.
It says through ADA. There is
Oh,
a response down below. Yeah.
okay. So there's no additional therapist specifically set up through ADA. It's just on whatever your primary mental health plan is, whether it's Medicaid or a private plan. Homeless Action Center and Bay Area Legal Aid got funding to help people. I knew it was somewhere. Thank you, Allison. So I was like, my brain just shut down around 6 o'clock and I had to reboot it for tonight. So yes, Allison has that information. The Homeless Action Center in Berkeley and Bay Area Legal Aid are both helping people apply for SSI and SSDI. How can I get an advocate for my daughter? There's a couple of answers to this question. You can get an advocate for yourself to work with your daughter through the Family Education Resource Center, also known as the FERC. In terms of how to get an advocate specifically for your daughter, you're most likely to benefit from a peer support network for your daughter. So working through the Office of Consumer Empowerment, the Pool of Consumer Champions, Best now various organizations that are developing and continuing the work and expanding the work of peer advocates. Those are the people that are most likely for your daughter to get connected with. And I would recommend the Pool of Consumer Champions. Even during COVID, they're doing fun events online and helping people feel less isolated, and they have numerous committees to work with. So I think that's a good place to start. One other thing that I've seen that's been really helpful for a lot of people is if you live anywhere where there is a community garden. I have found the folks that run the community gardens to be incredibly supportive and kind to our people, and have them work and have that socialization in the garden, even if it's just a couple of hours a week, and be able to come home with fresh food and, you know, just have some connections. So that's another piece that is not officially an advocate, but, you know, connecting people to the community. Can you repeat those peer advocate organizations?
Can you include NAMI as well, please? We also do advocacy.
Of course, yes. NAMI is definitely included in that. I was sort of assuming that since you're all calling in from NAMI. But yes, they're always included in that.
Thank you.
And you want that info in the chat. Okay, hold on a minute.
So Rosa, well, I assume you're using the chat box.
I'm typing, yes.
Okay.
I can listen and type at the same time, though.
Okay, I just want to mention that one of the things that we would love to see in our area is peers. And I know there was before COVID, there was a start of maybe a rap type training with the wellness centers, but all that's gone away. We've really and would love to see peers come out here where we just
Do
really
you mean
that
the
kind of support.
organization?
Sorry?
Do you mean peers, the organization, peers and
Yes.
listening?
Yes. And the
Okay.
services they provide.
Okay.
It's really hard for us to get to Oakland.
I know.
When it's face to face. It's easier. Now I know it's easy because we've got we got phone, we've got computers, we've got Zoom and all that. But if anyone wanted to face, it would be really great if that were to happen. So thank you.
Okay, I will check in with peers about what they could do soon.
Yeah,
I know everybody
that'd be
is still feeling very worried. People are not quite ready for in-person stuff yet, but
we're doing Zoom through the whole year. We're not opening anything in 2021.
I think that's very reasonable. That's how I feel. I feel like there's so many things we don't know yet. It's very important to be cautious.
Exactly.
Other questions that people maybe just want to say versus chat, or other thoughts, other things you want me to look into?
So I know, Allison, you wanted to say a few words. It's fine if you want to, if this is a good time for you.
Well, I'm muted again. I don't know if this is a good time or not. It occurs to me that who is going to advocate for your family member is a really good and deep question. If you're in it for the long haul, it's going to be you. You are going to have to advocate for your family member to get treatment. You can get help from a case manager. You can get help from a conservator. But if you have a family member that isn't aware that they need treatment, you're going to have to be the one to advocate for it. You can also get help from FERC. As Rosa says, they will advocate for you when they can. And you can get help from NAMI, and you can do other kinds of advocacy in the world outside. You can write to your supervisors, you can show up at hearings, but who is going to advocate for your family member to get help? That is going to be you. That's how it seems to work. And also, I'll put a link. This is totally separate, but a professor at UC Berkeley is doing a survey for family members in Alameda County. It's about waiting times to get help from, for example, John George, Villa Fairmont, Gladman, places like that. I'll put the link. I got a link directly to the survey, and I'll put it in the chat. If anybody's in Alameda County and has had experience in the last couple of years trying to get help for their family member, it might be a good idea to do the survey. It might, God willing, in the long run, turn up data that could give rise to some kind of changes. And I'll fish around, find that link and put it in the chat. The survey is done by Professor Candy Yano at Berkeley's Industrial Engineering and Operations Research Department. It's actually being done by 2 graduate students graduate students always need all the help they can get. But let me put that link in the survey.
I
And-
did send that out today and it went to Marcia as well, so I'm hoping it will get out to the links, but keep sending it out. The more the better.
I'll just put the link in the chat and maybe people can find the survey that way.
I'll pull it off and we can send it. We have an even larger list that we can send it to. So, yeah, thank you.
One of the things I wanted to say in response, Allison, is in our work plan right now, one of the things that we are really aware of is not just who's going to advocate for our loved ones now, but who's going to advocate for them when we're gone. So we're working on a program to really get experts in on how to set up trusts, advanced directives, powers of attorney, both financial and medical, ways to really plan for caregiving. And we've had a lot of people say, well, I don't need to do any of that. I don't need to do trust. I don't need to do a will because I don't have any resources. And what we're really being clear about is you as a family member are a resource. Even if you have not 2 dimes to rub together, what you do supporting your loved one is a resource. It is something that we need to look at together to figure out how that's going to be continued on when we're not there. So that's really important to, as part of my planning for our office, is how do we get people to really recognize all the different things that they do and plan for it to the best of their abilities, because this is the kind of stuff that keeps us up at night.
Okay, here's some resources in the chat box. Oh, the link that.
Yeah.
Oh, okay. What I'm looking at is your web, your link to the Office of Family Empowerment.
Yeah, it's a terrible link, though. I have to say, it's part of the county website, which is just awful. There was a question about, do you help with psychiatric advanced directives? Not directly, but part of what we're looking at is this whole program of what kinds of documents do you need to work with your loved one as a family to cover all of those kinds of things: advanced psychiatric advanced directives, medical advanced directives, long-term care, all the different things that come to mind. So we're not attorneys, so no, but we're working with attorneys and contracting with some of our legal aid CBOs to make sure we can put together a program that family members can access and get the truly good legal advice that they need to set these things up.
Okay, SAMHSA.
So Allison, I've got a question for you. I mean, Rosa, sorry. I was reading Allison's both there. So it sounds like, given that your website, you keep saying it's just such a mess, that our first step should be FERC. And if FERC thinks they need to refer to you, they would. I mean, do people, I'm just not quite sure.
FERC
You
does
know,
direct, FERC does direct services. They have family advocates that will work with you specifically on a specific issue.
Right.
They are the ones that we fund through my office funds FERC to do the direct work.
Got it. So is there a reason that I would call you rather than calling them? Is there something that you do? You know what I'm saying? It's like if FERC is the place, that we've all got connections with FERC, so
Yeah,
we're good, I think.
pretty much if you're like trying to do something that's specific to you and your family, you would call FERC. But
Okay.
sometimes there's something, maybe you've seen something, thought of something that could be done on a larger scale in a city or in a county, or an idea that you want to take further, that's beyond a direct service kind of thing. And that's when you might contact me, or just contact me because you don't know who else to contact, and then we'll work it out. I get a lot of those kind of calls where we just talk, and try and figure it out.
Great. Okay, thank you.
Okay, are there any other questions that anyone might have?
I am seeing
Yes,
Alice
I have a question.
note about advanced directive. Yes, it's not something you do in a one-shot try. Another policy that we're working on right now, actually, to hopefully be able to institute with clinicians in all settings, is not specifically about the advanced directive, but around a waiver so that family members can speak with clinicians and vice versa. And what we're looking at in the policy is to actually mandate a number of times per year that a clinician needs to actually bring up that this is your family, this is somebody, supports you outside of these settings. It would really probably be helpful for you to be able to talk to them and vice versa around all these issues, medications, et cetera, and to make that an ongoing thing, not sort of a once and dumped kind of thing. And so that same issue around advanced directives, et cetera, that this can't be something that you show somebody once and walk away and say, well, I tried. This has to be really looking at long-term, repetitive attempts to try and get as much information flowing as possible.
Now, there's someone that did have a question started to ask.
Yeah, hi. I'm sorry, I'm on the phone and my name is Hale. This is my first time joining the group. And I don't have access to the Zoom. For some reason, I wasn't able to connect. I wanted to know if there's any way, if you can please spell the FERC that you said. How do you spell it? Because I don't have access again to see.
Yes, if you go online, you just type in www.ferc.org and their website will pop up, like Frank,
Perfect.
Elephant, Rabbit, Cat.
Thank you so much. And I also have one question. I don't know if you explained this already or not. I kind of got connected a little bit late, but my son has been diagnosed bipolar, but of course he has paranoia and he doesn't believe that he has an issue. And I have medical. I'm a single mom, and we have Kaiser. But when he was hospitalized, it was back in November 2019 in San Diego. And over there, I guess the system is so medical, and Kaiser, only doctor gets to see what was going on in the beginning, but I don't. And I'm trying to apply for Social Security. We got denied because my ex-husband, his father was bipolar and alcoholic and all that. I'm just going to make the story short. And my problem is because he turned 21, and he doesn't want me to talk about his case. I don't know how to get access to his file since he's 21, because Medical and Alameda Alliances, they don't share the information somehow. So I don't know how to get those informations, for the history.
Yeah.
of
May I
what
step
happened.
in on this one, Rosa?
Of course, go right ahead.
And this is Marcia, and we've
Hi,
met
Marsha.
by phone. These are the issues that we go talk through on our support groups. And
We can, okay.
yeah, I really would encourage you. And Lisa from FERC will be there. So you get to meet
Okay.
all kinds of people that could be very helpful. And Mark Rahman is the co-facilitator. So I really
Perfect. This
encourage
is going to
you.
be on
Yeah,
the meeting on the 12th.
Sorry?
This is this is going to be in the meeting that we're going to have on the 12th, correct?
Yes, correct.
Oh, okay. Okay.
And
Thank you so much. I'm
I'll
sorry.
send you an email on that, so you'll get all the.
Perfect. Thank you. Thank you so very much. Thank you.
Sure.
Thank you,
Sorry,
Marcia.
Rick. Yeah.
No,
Thank
this, I would have said, I would have passed it to you right then. So it's perfect because this is what NAMI is all about, is us supporting each other and sharing information and, you
And
know,
collaborating.
Yeah.
and, you know, just trying to make things better for our families and our community. So this is exactly what I expected.
Thank you.
Allison has put in the 1424 form on the link, in the chat rather. It's also available on both the Alameda County website as well as the FERC website. And this is really
And NAMI
helpful.
Tri-Valley.
And NAMI Tri-Valley's website. It's probably on all the NAMI affiliates websites by now because I've been pushing this for a long time. But it's really incredibly helpful because it not only helps you kind of, I prepare them ahead of time in case, you know, so that they're ready to just fill in the most current things if there is a crisis, so that you're ready to roll. And it really makes a difference to have multiple copies and be able to get them to all the different places your loved one may touch in a crisis, so that they get the best possible care and don't get things that would further traumatize them, and could cause, you know, greater harm, such as medications that you know that don't work, or particular kinds of handling that doesn't work, etc. So I highly encourage everybody to print those out, fill them out, have them ready to roll.
Yep, we push that as at our support groups, educate families the best we can to encourage them to use that form. And if you don't live in Alameda County, that's okay. You can, that form works well in other counties.
Yes, it's the state.
Stanislaus uses it.
Yep.
Yeah.
Other thoughts, other things, I've got some homework to do to get back to you, and I'll get that to Marcia.
I have shared in the past that I used it in Washington State as well. So Washington State was willing to accept the AB 1424. So it
great.
really is a very useful form.
That's good to hear.
And that form was written by families along with the behavioral health management. And I occasionally sat in on that. So it was pretty.
More than occasion. You were very much a driver of that. Don't sell yourself short.
I don't know about that, but I did have my say. So it's a very smart form that gets to the point. So if you haven't seen it, and if you get it through FERC or behavioral health website, ours is under crisis numbers, NAMI-trivalley.org, and I'll put that in the chat. In the left-hand column, so it says AB 1424, and it's a PDF. So you just download it. Easy to get to.
I have a question for folks. Are your loved ones getting vaccinated for COVID? Yes?
Mine didn't yet.
And some are not, obviously.
Yeah, mine's
No.
not. He doesn't believe it's a
Mine-
thing.
Yeah.
Yes, here. Yes.
Yes. One of the things that I've been talking with the medical office about is that waiting for the Janssen vaccine. I mean, we've been doing vaccines at spots like at the Eden Clinic and different places trying to get our consumers in. But once we get the Janssen vaccine, which is a one-shot vaccine, that might be a good opportunity to have some kind of, you know, a few different kinds of events to hopefully pulled in people that maybe weren't going to be able to do the 2 vaccines perfectly timed apart, and may be willing to do a 1-shot from a company called Johnson & Johnson that they've known through their whole lives as baby powder or something. You know, there's just so many things that cause a person to feel a trust or not. So we've been talking about that as well, because we know that, you know, mental health diagnoses and the incredibly difficult medications that people take that really do impact people's metabolism and their endocrine system, makes people with serious mental illness very susceptible to extreme effects of COVID. So we really want to get our folks vaccinated. So any ideas you have, any thoughts around that to pass on to me, that's something that I'm, you know, constantly advocating for with the medical office and with Healthcare Services Agency, Public Health.
I would like to say something. The clinic where I've gotten my vaccine, they have real specific guidelines, and they do have mental illness as one of the
Criteria. Mhm.
criteria. And it, like, you have to be so bad that you can't go get services. And my son is, you know,
No,
is on things going on. Should I just do it, have him qualify, just check it anyway?
Just check it anyway. Oh yeah, they have, that's so wrong. I hate to hear that. It's
He's not
so
bad enough to get his vaccine yet.
yeah, no, it's sort of like our, well, you know, we could talk about our failed first system until midnight. But no, with this, check the damn box. Just get him to the door if he's willing to go. Yes, please.
Very much.
An invisible disability. It's ridiculous. I hate to hear that, but I know it's true. Thank you for letting me know.
This is the Tiburcio Vasquez.
Tiburcio Vasquez in Hayward.
Mine's in San Leandro, but same.
Yes. Yeah. They have been vaccinating a lot of our clients. So I think the paperwork and the website isn't actually jiving up with what they're doing in person, which I have not heard anybody get turned away.
Okay. I read it in such a way that I thought he didn't qualify. So I
Yeah,
will.
no, he definitely qualifies.
Thank you. Yay.
And I'm also looking in the chat again. Yes, Kaiser. Yes, and I've seen that. I'm a Kaiser member as well. So yes, Kaiser is also totally including people with any kind of disability, including mental health disability, under their watch. And I know some of us have our loved ones on both Medicaid and a CBO, and maybe still under our health plan for certain things. So whatever you can utilize to get that in their arms, go for it.
You know, I'd like to mention that my son lives in Contra Costa County, and I don't know what they're doing, but they're doing an incredibly fantastic job. They sent, my son's in a board and care, but they sent CVS pharmacy staff into the homes to vaccinate them rather than have everyone pile in a van and go down to the pharmacy. So anyone who has a disability in a group home setting, which I know was in that first tier, wasn't it? But they got it done early. And
yeah.
So, you know, to me, that means my son has a chance to live longer. And because people in that category, and I'm noticing people with schizophrenia are 3 times more likely to die of COVID as a general population, and I did read that, but I mean, I can't tell you the relief I feel that he's protected.
That's huge.
For months, 6 months or something. Yeah.
Yeah, Alameda County did the same thing with boarding cares, both licensed and unlicensed.
Oh, okay. Yeah.
Setting up at different clinic sites, but you know, there's that hit and miss factor. So I keep feeling like no matter what we do, we need to just, you know, circle the wagons again. Like, who did we leave out? Because, you know, even just to do this together, you know, we have the ability to be somewhere where we have some kind of device and the ability to, communicate. That's not true of our most vulnerable family members or consumers. And that's where my real worry is the people that we're not reaching, that we would have reached, some of them at least, in person. And it's just, not everybody can use this platform.
Oh,
Well, I will add also in when I was scheduling my vaccine um, last week that you can get the vaccine through Kaiser even if you're not a Kaiser member. There are a little bit of hoops to jump through, but that's also another route that you can look at. You have to call member services, ask them to give you a Kaiser number, and then once you get that Kaiser number, you can then apply to get your vaccine. So
That's great. And I've seen that in the opposite direction at, like, I went to work at the Solano County vaccine spot, and all kinds, Kaiser, Aetna, Blue Cross, Sutter, everybody was pitching in with the funding, with people there to give the vaccines, with people there to monitor, to, do, all of that process was being handled by people from all kinds of health plans. And a really good example of what can work when people actually decide to collaborate. We have about 2 more minutes. Anything? Oh, Professor Yano's link Allison just put in.
oh, great.
Christine says Tiburcio Vasquez was super easy. I'm so glad to see you all, even if it's just like this. I have to say though, Marcia and I have had a tradition for over a decade of us meeting around 5:30 and having wonderful Vietnamese food
Lemongrass.
at the Lemongrass, and then coming to the library, and then having our meeting. And I miss that. I really do.
I miss that
Each
too.
other and eat dinner together
Next year, Rosa.
Next year.
I
Absolutely.
promise. I'm hosting. Everyone,
Good.
goodness, yeah,
We'll do it. We'll do it.
good. Thank you.
Well, Marcia has all my contact information, as do many of you also. If things come up that didn't get covered tonight, as soon as you click off, you go, oh, I should have asked, please feel free. And I will look in on, getting peers into something for NAMI Tri-Valley, see how we can kind of mush them along a little bit. Allison already put in the SSI information, but I'll go ahead and redo it as I send it to Marcia so that it can go out in the email. And yeah, we'll just keep talking. That's what we do.
I have one more question.
Of course.
And it's one that's, I'm not getting an answer. And it may, I don't know if this even is in your area of who you might even know we might contact, but I know Bax had the contract for wellness centers, and they were drop-in centers and activities,
Yes.
all in it, and for all the right reasons they closed. I heard a rumor that it might change into something else. And have you heard that? Or
I
I'm
have
very
not.
worried about that.
I have not. Actually, there's, as far as I know, and which is as far as I know, there is continued commitment to the wellness centers because it's such an easy way for people to pop in and start to connect.
That's what we have had here. Yeah.
Yes, and we need them, and we need them reopened. I have not heard about them being repurposed in any way. The only thing I've actually heard about is there a way to add more to them, in terms of, because of the not just mental health and a place to have activities and have, a snack or a meal, but that due to COVID, would that be another place to have, maybe once or twice a month, a primary care option available, some ways to make it even more
Good.
robust. So I've not heard about the opposite at all.
I guess the last thing I want to mention while everyone is here is that there are plans for a mental health urgent care in the Livermore, Dublin, Pleasanton area to be housed in Access Community Health in Pleasanton. And this is not a county project, it is a local project, and this project is being funded by the cities of Livermore, Dublin, and Pleasanton. So behavioral health, Alameda County Behavioral Health has offered seed money for the first year, and it is a one-year pilot project program, but we believe the need is great out here. The value of this,
Within 20 years, Marcia.
yeah,
You've been
okay.
asking for this for over
The
20
value
years.
of it is that you don't have to have a specific insurance to qualify to go in and get crisis care. So you just walk in. Okay,
Do you know if there's going to be, I don't know a lot about this, so I'll
I'll
look into
send you
it.
information on that.
Is there an evaluation component to this, being that it's a pilot?
I don't have that detail.
Okay, let's
I
look
will
into that.
find out.
You've wanted this for so long. It's so desperately needed. We need to make sure that people are aware of it, so that it's really utilized, and that those stats come up and it moves from a pilot to an actual program.
Well, that's what we're asked. NAMI Tri-Valley is being asked to get the word out, and it will be managed by and run by Access Community Health and in their behavioral health department. So they're an FQHC,
Yeah.
Federally Qualified Health Center. So I do know of the management that runs that department. They are very competent, but I will ask.
I'm sure if it's given that it's access, I'm sure there's a good evaluation component.
Yeah. I mean, how can they determine, whether to continue this or not without that? I would,
Exactly.
along with a lot of data. So.
This is good to know. Do you know when it's scheduled to open?
Well, here's the thing. They said July 1st, but I need to clarify. Are you saying that the clinic is up and running in July 1st, or are you starting to build you'll receive funds and start to build the clinic? So I need to, get that answer as well. So I'm not quite sure about that.
That's exciting. I'm happy to hear that. That's really a critical need.
Yes, thank you. So that's it. That's what I have.
Okay.
And if anyone wants to stay on, I have a couple of brochures. I have the 911 brochure, and that I would like to add. And then let's see if I can figure this out. Okay. And oh, okay. Maybe I don't. We will put it on our website as well. Or if anyone wants to email me, then I will send you a copy. And I'm just putting in the email address. Okay, well, thank you, Rosa. Good to see you. Let's keep in touch more often. There's a lot of
Definitely.
Yeah.
Thank you so much, everybody. Just sending you lots of compassion. You are all warriors, working on this very journey we did not ask for, but we're doing it. So really appreciate you being here tonight. Thank you for having me.
Thank you so much. Thank you.
Thank you.
Thank you so much.
Thank you.
Okay.
Thank you, Martha.
You're so welcome. Thank you. I'm really thank you for everyone tuning in on this. Next month, we're going to have Dr. Treble, the director of behavioral health in Alameda County. It will be good to hear what she has to say, what's going on. And May is Mental Health Month. So we'll send out information on that for everyone, then a reminder. And do check our website, because the Zoom link is up on general meeting. That's a public meeting. And we also send out a reminder to anyone who's on our email lists. So, okay, thank you.
Thank you. Bye-bye.
Bye.
Thanks, Marcia. Bye.
Hi. Good night. Okay.
I'm surprised that not all our board members were present tonight.
Well, yeah. Yeah, hey,
I'm going to sign off. Just a sec.
yep.